Hi, my name is Stephen Maldonado, dietetic intern with Wellness Workdays. For today's topic, I'll be going over the micronutrients or the vitamins and minerals that are affected by dialysis for those that have chronic kidney disease. So before jumping into the vitamins and minerals aspect, I kind of wanted to briefly touch on uh, hemodialysis itself. Hemodialysis is a machine that filters wastes, salts, and fluid from the blood when the kidneys are no longer healthy enough to do this work adequately. And hemodialysis is a way to treat advanced kidney failure and can help carry on an active life despite those failing kidneys. And the average treatment does last around 3 to 5 hours and is performed three times a week. So for the vitamins and mineral deficiencies, what affects the vitamin status? Uremia is a big factor. Uremia is a sign of chronic kidney disease. It is a buildup of toxins in the blood, and it's something that occurs when the kidneys stop filtering toxins out through the urine itself. So uremia is often a sign of end-stage renal kidney disease. And you can see here that the nutrient losses that take place in hemodialysis include sodium, vitamin C, vitamin B6, folic acid, potassium, phosphorus, magnesium, iron, and zinc. And back to the symptoms of uremia, that can include nausea, anorexia, altered taste sensation, which can lead to reduced oral intake and an increased risk of malnutrition in patients with chronic kidney disease. We also want to take into consideration for these types of patients that do end up having alterations or restrictions to their diet, as that can also play a role in how a vitamin intake and mineral intake is affected. So sodium is something that does help the body keep the fluids balanced. It is a key role in normal nerve and muscle function. And the daily sodium allowance for patients who happen to receive hemodialysis is 2 grams per day with adjustments based on the urine output. So the more urine that the patient produces, the more sodium the patient may eliminate through the urine. We also want to make sure that there may or may not be adjustments that need to be made as far as the intake of sodium based on blood pressure, medications, the functionings of the kidney, the hydration status, acidosis, glycemic control, catabolism, and GI issues such as vomiting, diarrhea, constipation, or gastrointestinal bleeding. As far as sodium levels go, if they do fall below the normal range, that will lead to hyponatremia, which can cause nausea, vomiting, headaches, confusion, loss of energy, muscle weakness, cramps, and seizures. Now, if the sodium levels happen to be above the normal range, that will be known as hypernatremia, which can lead to excessive thirst, lethargy, muscle twitching, and spasms. And here we have kind of like a list of sources for sodium. For the sodium sources, just about almost any food you can think of has some traces of sodium. So here I just kind of listed some sources, food sources that do have some of the highest intakes of sodium. So we have here a tomato sauce, sauerkraut, pickles, tomato juice, olives, potatoes, bread, hot cereals, rice, bagels, saltine crackers, and anchovies. So for vitamin C, it's also known as ascorbic acid, and vitamin C is needed for the formation of blood vessels, cartilage, for muscles, and collagen in the bones. When it comes to the dialysis process, vitamin C is readily cleared. It is soluble, and amounts of 50 milligrams or greater can be removed by a single treatment. And vitamin C at the end of a single treatment is typically decreased by 2/3. This high clearance of vitamin C has led to that high probability that the hemodialysis treatment itself is most likely the primary cause of those low levels of vitamin C in people. So vitamin C in dialysis patients is frequently less than 10. This level is associated with scurvy in people with that are non-dialysis. And vitamin C supplementation is something that is recommended for adults, which ranges 60 to 100 milligrams per day. Some sources of vitamin C include oranges or orange juice, strawberries, bell peppers, dark green vegetables, kiwi fruit, tomatoes, and we also note that the oranges and strawberries, they also happen to be potassium rich, and those specific fruits need to be taken into consideration as far as how much a person should be consuming or maybe not consuming, depending on their potassium levels, because as we will see later on, potassium is a mineral that is affected by hemodialysis itself as well. So for vitamin B6, this is needed for normal brain development. And if someone is to consume more than 100 milligrams per deciliter, that can cause toxicity. And it is also important, vitamin B6, for keeping the nervous system and the immune system healthy. So as far as deficiency goes, some signs of it can include normocytic anemia, nonspecific pruritic rash, cheilitis with scaly lip skin and cracks on the corner of the mouth, glossitis, which is the swelling of the tongue, or depression. Some sources of vitamin B6 can include things like poultry, fish, potatoes, chickpeas, bananas, and fortified cereals. As far as supplements or recommended supplementation goes, that can range from 10 milligrams to 20 milligrams per day. Folic acid, or also can be known as folate, is a vitamin B9, and it is needed for red blood cell formation and cell growth and function. This nutrient is crucial during early pregnancy, and it can be used to help reduce the risk of birth defects of the brain and the spine as well. The recommended supplementation would be 1,000 micrograms, or also it could be 1 milligram per day. And as far as signs of deficiency go for folic acid, that can include tiredness or fatigue and lethargy, muscle weakness, shortness of breath, nausea, vomiting, diarrhea, weight loss, depression, confusion, memory problems, headache, or dizziness. And sources of folic acid can include dark leafy vegetables, beans, peas, nuts, and fruits such as oranges, lemons, bananas, melons, and strawberries. Potassium is that mineral that is needed to serve for the nerve signal transmissions. It's also needed to support muscle contractions, fluid balance. And as far as hemodialysis relationship with potassium goes, hemodialysis does remove some potassium throughout the process. So monitoring those levels are important to ensure there's enough intake. Otherwise, hypokalemia can be a result of that. And hypokalemia is referring to a less amount of potassium in the body. And signs of deficiency can include metabolic acidosis, hypokalemic kidney disease, leg cramps, weakness and paresis, ascending paralysis, constipation, respiratory failure, cardiac arrhythmias, and heart failure. The recommendation intake is between 2 grams to 3 grams per day. If dialysis is not being supported enough, if there is an inadequate amount of dialysis, then that could also lead to hyperkalemia. high levels of potassium in the body. So some sources of potassium include potatoes with the skin, yams, cooked spinach, bok choy, soybeans, corn, lentils, and fruits such as jackfruit, kiwi, melon, banana, grapefruit, apricots, and peaches. So phosphorus is a building block for healthy teeth and bones. It is a buffer that helps the pH level in the blood to keep balanced. It also assists in converting fat, carbs, and proteins into energy. So with that being said, hemodialysis session, a single session can clear just about 600 to 1,000 milligrams within the first 2 hours of that session. So the recommended supplementation for phosphorus would be 10 milligrams to 12 milligrams per kilogram of the person's body weight. And as well as phosphorus standard body weight, or 800 to 1,000 milligrams when serum phosphorus levels approach the upper limit of the normal range. And some signs of deficiencies can include bone pain, fragile bones, stiff joints, fatigue, breathing problems, loss of appetite, and electrolyte imbalance. Sources of phosphorus can include meats and other proteins, milk and dairy foods, beans such as navy, kidney, soy, pinto, and garbanzo beans. And grains can include bran and wheat. And nuts and seeds can include almonds, cashews, peanut butter, and sunflower seeds. Magnesium. Magnesium is needed for energy metabolism, DNA, and protein synthesis. It does help regulate muscle contractions, and it helps maintain a healthy brain function as well. Excess magnesium mainly accumulates in bone tissue, where it is deleterious to bone metabolism. And symptoms of excessive amounts of magnesium can include muscle weakness, hypotension, electrocardiographic changes, sedation, and confusion. As far as the normal range for magnesium goes, that will be somewhere between 1.7 milligrams to 2.2 milligrams per deciliter. Sources of magnesium include pumpkin seeds, boiled spinach, black beans, flax seeds, almonds, cashews, dark chocolate, avocado, tofu, or salmon. So for calcium, the use of, it does make up a lot of the structure of the bones and teeth. Calcium is needed for the heart, the nerves, and blood clotting systems to work properly. General dietary recommendation does depend on serum calcium levels for chronic kidney disease patients. It is important to note that the use of vitamin D and other supplements can impact the calcium level, and it should definitely be considered in the nutrition assessment of calcium needs. So the presence of calcium in the dialysate helps to normalize those serum calcium levels in patients who do receive hemodialysis. And along with the use of an activated source of vitamin D, like calcitriol, it will be used in order to help reach a normal range of calcium. And patients receiving hemodialysis need to have that active source, again, as a reminder, in order for calcium to work properly. Because calcium is typically going to be impaired in presence of uremia, which is why it is needed. As far as the intake goes, it should be less than 2,000 milligrams per day. Sources of calcium can include yogurt, milk, cheese, spinach, collard greens, bok choy, and protein foods such as tofu, sardines, salmon, tahini, or orange juice and grapefruit juice. We also have trace minerals that do play a bit of a role in terms of being affected by hemodialysis. And those trace minerals do include zinc and iron. So with patients with chronic kidney disease experience alterations in the metabolism, zinc being one of them. It is a nutrient that's found throughout the body. It does help the immune system and the metabolism to function. Zinc is also important for wound healing and the sense of taste and smell. And as far as the supplementation for zinc goes, it should be 15 milligrams per day. Whenever there is a deficiency in iron, that does lead to anemia. And anemia is a common thing that does happen in chronic kidney disease. So it's important for iron, that the mineral itself needed for overall good health and healthy blood cells. Iron does help the body make hemoglobin, which is something that's found in the red blood cells. So when there isn't enough iron in the body, the red blood cells won't have enough hemoglobin to carry oxygen. So trace minerals should be supplemented or restricted only after performing the appropriate biochemical assessments. Some sources of zinc and iron include rock oysters, lamb, beef, pumpkin seeds, crab, almonds, oats, chicken breasts. Iron sources can include wheat cereals, beef, sardines, turkey, shrimp, spinach, artichokes, or lentils. Thank you.